my name is Mackenzie. I'm the scribe working with Dr. Crosswell today. Is it okay if I ask you a couple questions?
Sure.
Okay. So, any past medical history that we should be aware of to kind of help us figure out your symptoms today?
The only thing I can think of is my grandfather had an autoimmune disease.
Okay.
But other than that, that's about it.
Okay. Any social history? Any like emotional or physical stress?
I've been really stressed out lately,
Okay.
but that's about it.
Okay. Any tobacco use?
Nope.
No? Okay. Okay, I'm gonna go get Dr. Crosswell.
Okay.
Is it okay too if we have a student with us today?
Yeah, no problem.
Okay, perfect. Dr. Crosswell,
Yes.
before we get started, our student Lexi's gonna be with us today. Is that okay?
All right, that's fine. Bring her in.
Thank you.
Hi, Dr. Crosswell.
Hey, how are you, Sarah?
I'm okay.
Oh my gosh, Professor Crosswell, I didn't know you worked here.
Well, turns out I'm actually a doctor now. Who would have thought? Professor, doctor.
All right, I went from business to biology. So look at
Exactly.
that.
Same type of thing. All right, so let's get into it.
Hello.
Sarah, what brings you in today? Talk to me.
So it started off, I had felt really, really tired lately, just overall fatigued. I've been kind of anxious and I've been noticing that my heart's been palpitating a little bit, so that was kind of odd. It's caused me to lose a lot of sleep, and I've also noticed that I've lost a little bit of weight that was abnormal because I haven't really done anything out of the norm.
Okay. All right. Well, based on that information, I'm just going to assess your eyes and your throat. So would you mind if I do that?
That's fine.
All right. So I have my handy dandy. All right, Sarah, can you please open your eyes for me so I can just check them quickly? All right, sounds good. And then looks good, everything looks good. The next thing I'm going to do is I'm just going to palpate your throat. Is that fine?
That's okay.
Okay. Okay, so it looks like your throat is slightly swollen. Slightly swollen in the throat area. All right, sounds good. So Lexi and I were gonna step out, and Mackenzie will take over from this point. But any questions, please feel free to let me know.
Okay, sounds good.
All right.
Yep, thank you for letting me shadow.
No problem.
Okay, sir, so we're just gonna get some labs, then you should have your results in about 1 week.
Okay. Yep, sounds good.
Okay, perfect.
Will there be like a follow-up appointment or something like that?
There will, yes.
Okay,
Yeah.
awesome. Thank you.
Okay, so I pulled up Sarah's lab work for us to look at. So the first value, so this was the thyroglobulin auto AB. So her value of 35 was within the standard range. And this is an interesting one to check because this level kind of refers to the auto antibodies that attack thyroglobulin proteins and destroy the thyroid. So high levels of this are a clear indicator for a severe autoimmune disease, whether it's Graves or hyperthyroidism or Hashimoto. So seeing that her value is normal can kind of rule out some things, or maybe not looking at the other lab work.
Excellent work, Mackenzie. So moving on to our second lab value, the TPO auto AB. As you can see, the value was less than 10, which is out of the normal range. That is much lower than we want that to be, and that would indicate that this individual has the condition. Those lack of antibodies would be indicative of someone who does have this particular condition. So, as we look at the next value, Lexi, do you remember anything from lecture and me talking about the thyroid stimulating immunoglobulin?
Yes, I think I remember TSI was like the chance of a relapse after the patient has been administered their drug. So
Yes.
and Sarah, our patient's case, hers was 293, so that's a really high chance of her relapsing if she does have Graves' disease, right?
Awesome. Yeah, that's totally
Nice.
correct. Alright, so we'll move to the next page.
Yeah.
Okay, so our next values are the T3 and T4. So we know for Graves' disease, the consequence of having a hyperactive thyroid is increased production of those thyroid hormones, secretion of those thyroid hormones. And you have the triiodothyronine, and then you have the T4, which is the thyroxine. And you would see an increased level of both of these thyroid hormones being secreted in Graves' disease because you do have a hyperactive thyroid. And then for our last value, we have thyroid stimulating hormone. It's decreased because you have those antibodies that are building now. As we mentioned on the previous page, where we saw some of those increased antibodies. You have the TSH levels are going to decrease, and that kind of is the body's way of trying to compensate for those those increased antibody levels.
So then, Dr. Crosswell, does our patient have Graves' disease?
Yes, yes indeed. This patient does have Graves' disease.
Hi.
Hey Sarah, how you doing?
I'm doing good. How about you?
Pretty good. You mind if I sit?
No, go ahead. Hi, guys. Hello. Hi.
So I have some news on your diagnosis. It turns out that you do have Graves' disease.
What exactly is Graves' disease?
So Graves' disease is a disease in which an individual will have a hyperactive thyroid. It is caused by thyroid stimulating immunoglobulin, also known as TSA. The B cells are responsible for synthesizing this TSI, or thyroid stimulating immunoglobulin, within the thyroid cells, but it can also be made in the bone marrow. And what you have happening is the B cells, they're stimulated by the T cells, and they're sensitized by the antigen in the thyroid gland. And TSI is going to bind to this thyroid stimulating hormone receptors, and that will ultimately result in the production of your thyroid hormones, so your T3s and your T4s that I spoke about. So the synthesis of thyroid hormones and the thyroid gland activity will be stimulated by the binding of the TSI to the TSH receptors.
Okay, so this is obviously abnormal. What's it supposed to be like normally?
Well, Lexi, can you explain to her? There was something that I mentioned in class about normal thyroid function.
Yeah, I remember you mentioning your thyroid is part of your endocrine system, and basically your thyroid is regulated by TSH, or thyroid stimulating hormone, and that's released by your pituitary gland, I think.
Yeah.
And basically you're going to be releasing a lot of the T3 and the T4, and when you're releasing so much of this hormone, you're going to have a hyperactivation. Basically, that's what's going to give you your Graves' disease.
Did you understand that?
Yeah, no, that makes sense.
Great.
You're a very good student.
Yes,
Thank you.
she is my best student.
All right, so what do I do about this?
So we're gonna have to get you on a treatment.
Okay.
Mackenzie, can you talk to her a little bit about her treatment options?
Yeah, sure. So 2 different options that we have here. So one of them is the radioactive iodine therapy. So this will decrease the thyroid activity, but this is often not recommended for someone of your age, 20 years old, right?
Yeah.
Okay, so this is often not recommended because the radioactive therapy can sometimes increase your risk of cancer. So one of the other options is surgery to remove all or part of your thyroid. So this is often not recommended too, because we may be able to treat your condition with medication. So we could go over some of the medications. I'll check with the pharmacy and your insurance and see what's available. So it looks like there are 2 anti-thyroid medications available right now, propylthiouracil and methimazole. So these medications are both to be taken as a tablet, potentially for the rest of your life, depending on the condition. Some side effects may include joint pain, rash, liver failure, and a decrease in disease-fighting white blood cells. Additionally, just like all drugs, there are some dangers of these medications. So the propylthiouracil may result in liver damage within the first 6 months of treatment. So if you do experience any of these symptoms, definitely stop the medication and call the office to make an appointment to meet with us again. And then also, methimazole is not recommended for pregnant women, as this can cause birth defects. So definitely some things to consider, and you can have some time to think about it and let us know what you're thinking.
Okay, so how do I choose between the 2 medications then? I mean, I don't want liver failure, and I'm not really planning on getting pregnant anytime soon, so I guess that my best option would be the methimazole.
Yeah, I think definitely for now, if you're not planning on being pregnant in the next couple of months or the next couple of years, then definitely that would be your best bet for now. And if you do plan to get pregnant in the near future, you can always let us know and we can look at different treatment options for you.
Okay, so how many tablets am I looking at taking?
So I want you to be able to wean yourself off of this. This is not something I want you to become dependent on. So I'm gonna start you out with 1/4 of a tablet to take once a day.
Okay, and then we'll just get lab work again at some point and see where I'm at and adjust from that point on.
Yeah, that sounds good. I'll write your prescription right now. Can I
Okay.
borrow your pencil, please? Thank you. Sorry, I'm a little unprepared.
It's okay. Alright, thank you so much.
So that is your prescription right there. Thank you. Thank you very much. So that is your prescription right there. You can schedule with the lady at the front desk for your next appointment. But with that being said, do you have any more questions?
No, that's it. Thank you.
All right, awesome.
Well, actually, I have a question for you.
Yes.
Is it okay if we have a student with us today?
Sure.
Okay, I'm
Bring
gonna
her
go
in.
get her. Her name's Sarah. Oh. I go, her name's Sarah.
You want me to restart it?
Oh, it's Professor Crosswell. I didn't know you worked here.
Well, that's. I'm so sorry. I'm so sorry.
That should go in.
I'm so sorry. I'm so
That needs to go